A paper called WHO representative in the occupied Palestinian territory, Dr. Richard Brennan, Regional Emergency Director in the Eastern Mediterranean Regional Office, and Hyo Jong Kim, who leads the Unit on Attacks on Healthcare Initiative. Now, without further delay, I would like to give the floor to Dr. Ahmed Al-Mandari. You have the floor, Dr. Al-Mandari.
Thank you very much, Patila, for giving me the opportunity to join this important, press conference. WHO strongly condemns the attack on Al Ahli Arab Hospital in the north of the Gaza Strip. The hospital was operational with patients, healthcare givers, and internally displaced people sheltering there. Early reports indicate hundreds of fatalities and injuries. The hospital was one of 20 in the north of the Gaza Strip, facing evacuation orders from the Israeli military. The order for evacuation has been impossible to carry out given the current insecurity, critical condition of many patients, and lack of ambulances, staff, health system bed capacity, and alternative shelter for those displaced. WHO calls for the immediate active protection of civilians and healthcare. Evacuation orders must be reversed. International humanitarian law must be abided, by which means healthcare must be actively protected and never targeted. Thank you, Patila, again, back to you.
And thank you, Dr. Al-Mandari. Now, to Dr. Mike Ryan.
Good evening, everyone. We are all deeply shocked by the events unfolding in Gaza this evening. The Director General, Dr. Tedros, cannot be with us this evening. He is fully briefed. He's currently mid-air flight back to Geneva from Asia. He's already expressed his shock and his condemnation, and we'll be back in Geneva tomorrow, and we'll make further comments. I would like to pass to Dr. Rick Peppercorn, who can give us more of an update from the field.
Thank you, Mike. So first of all, like my colleagues from WHO, Occupied Palestinian Territory, we want to express our deepest grief at the horror that has unfolded in this evening at Al Ahli Hospital. And this attack is unprecedented in a scale, but WHO has seen consistent attacks on healthcare in occupied Palestinian territory. And just to provide you with some number, from last Saturday, we reported on 115 attacks on health, 51 of them in Gaza, with 15 health workers killed on duty, 27 injured, and 24 health facilities affected and damaged in Gaza. This is before this horrible attack on Al Ahli Hospital. So this morning, we already reported over 3,000 people killed. 3,000, of which half of them are actually women and children. We also talk about 11,000 injuries, and now we talk about hundreds of more death and hundreds of more injured. I want to also raise something, and I want to raise a plea that what is needed in Gaza now is an immediate access. This corridor at Rafah needs to be opened as soon as possible. There's an absolute need for fuel, water, food, and of course medicines and medical supplies. The supplies are ready. They're at the border. They're waiting to get in. There's an absolute need for this. This horror has to stop. Over to you.
Thank you. Now I would like to open the floor to journalists, starting with Agence France Presse, Robin Miller. You have the floor, Robin.
Thank you. Do you have any information at this stage as to how this incident came about and as to how many people are dead and injured? Thank you.
Dr. Peppercorn, do you want to take this question, or Dr. Al-Mandari?
I refer it to Dr.
Yeah, I can start with only the beginning. It's I think you've seen the various media outlets. As that people talk about hundreds of fatalities and also hundreds of injuries. That's all we can report on. Of course, we will get more data. I've seen data ranging from 200 till 600 and 800. So I find it difficult to speculate. This needs to be, and of course, this will be verified soon.
Thank you. I would like now to call on Moussa Asi from Al Mayadeen Television. Moussa, you have the floor.
Merci. Est-ce que vous entendez?
Oui, très bien. Allez-y.
Merci. My question for all of you. Can you consider this attack like a war crime? Thank you.
Thank you, Moussa.
This is Mike Ryan. International humanitarian law calls for the protection of civilians, and particularly and specifically calls for the protection of healthcare facilities and healthcare workers. Any intentional attack like this, the word war crime is a specific term that's attributed under law. We as WHO can't call it that. What we can say is that any attack on healthcare, any attack on health workers in this situation is a violation of international law. The attribution of that, though, and the causation of that, it's impossible for WHO to make to be able to determine that. We document and verify attacks on healthcare all over the world. And Rick has outlined the relentless attacks on healthcare in Gaza over the last week or so. There have also been attacks on healthcare in Israel. It doesn't matter where it happens. It doesn't matter. What matters is that civilians, health workers are at risk, and the very place that can save the life of an injured civilian become a place of death. And those health workers who risk their lives to save people are at risk of death. So in that context, it's exceptionally important that everybody works to protect healthcare installations. They're well identified. Everyone knows where they are, and they need to be deconflicted and protected. And any violation of that has got to be condemned.
Maybe I want to add something on this. We all know that all those hospitals in their compounds, in their courtyards, there are hundreds, thousands of internally displaced people. They go to these hospitals because they expect they're safe places. If a hospital is not a safe place anymore, what is? So and that's why WHO, we always focus that needs to be an ensured protection of health facilities, health workers, patients, and civilians. And in this case, everybody is aware that all the hospitals in Gaza, all their compounds, all their courtyards are full with internally displaced people.
Thank you. Now I would like to invite Catherine Fiancon-Bolanga to ask the next question. Catherine, from France 24.
Thank you, Fadela. Good evening, gentlemen. My question is regarding the border. I don't know if one of you is close of the border or have direct contacts with people that are at the border. I mean, the passageway between Gaza and Egypt remains sealed to the refugees, but also to humanitarian aid. So I'd like to understand if you could give us more indication about what is exactly blocking, because we know that Israel is bombing some of the places very close of that border. Certain information says that Egypt has remained the border open its side, but that it's not possible to cross it the other side. Could you please clarify the situation? And a follow-up on that question, what about airdrops, dropping some aid, airdropping from some aid? Thank you, Fadela.
Thank you, Catherine. Maybe Dr. Brennan can take this question.
Thanks. Thanks very much, Fadela. No, it's a very important question. As you rightly say, the Rafah crossing remains closed at this stage, and there's a lot of aid that's been built up on the Egyptian side. WHO, we've had life-saving medical supplies and equipment lined up for the last 3 days. We're ready to go as soon as there is an opening. But it's extremely frustrating. There's food, water, other urgent supplies waiting to go. As to the reason why the border isn't open at this stage, there are a lot of different dynamics going on, we understand. There is a lot of, frankly, finger pointing on this. And we also know that there's a lot of diplomacy. Senior UN officials are arriving tonight in Cairo and tomorrow. And I hope that they will be able to negotiate with all the relevant parties to get the opening going as soon as possible. Regarding airlifts, that has been an option that's been discussed. But of course, we're going to need the same types of clearances as we would to open the border crossing. And that would only be a temporary measure, of course, as well. But it's in the hands of the diplomats and the decision makers at this stage. We're ready to go as soon as they give us the green light.
Fadela, if I could just add,
yes, please.
Airdrops can be a life-saving intervention, but the volume of material one can deliver in an airdrop is so much lower than what can be delivered by trucks and overland. And we have over 2 million people in need of assistance here. So the scale of airdrops that would be required would be massive. Airdrops require preparation as well. They require landing zones for those airdrops. They require people to be on the ground in order to receive those airdrops and be able to distribute them to people with trucks and logistics. So airdrops are not really, as Rick said, there are real issues in terms of the airspace over Gaza. There are real issues in terms of how that could be achieved. The simplest, safest, and most effective way to get aid to the people of Gaza is the Rafah crossing right now. And it's not just the Rafah crossing, it's what happens on the far side of that crossing. Because delivering aid to the other side of the crossing is not good enough. The people are scattered all over Gaza. The hospitals are scattered all over Gaza. There needs to be safe access to those facilities. Trucks would need to move to those facilities to deliver that assistance. We've seen people moving to the south. We've seen people try to move to the south. We've seen them attacked moving to the south. We've seen attacks in or around Rafah today. So the conditions do not exist right now inside Gaza in order to be able to bring aid in and distribute it safely. There must be a cessation. There must be a cessation of the bombing. There must be a cessation of the bombing in order to allow that assistance to get in. There must be guarantees given. And our vehicles and the vehicles of the rest of the UN system need to be deconflicted. There needs to be safety guarantees so that aid can get to where it needs to go. So the operation is complex. It's not just an issue of opening or closing the gate at the border. It's going to require very, very high level diplomacy between multiple countries. The violence has to stop, the bombing has to stop, and we have got to get assistance to the people of Gaza. And that needs to happen now. That needs to happen tonight. That needs to happen tomorrow morning. This cannot wait. It simply cannot wait. We acknowledge the suffering and the terror that was caused to the people of southern Israel and all over Israel last week. We can feel the fear and the fury. We acknowledge that. This is very important. There were savage attacks, and we can understand the rage and the fury of the people of Israel. But you cannot justify what's happening to the ordinary people of Palestine. This has to stop. 2.5 million people are in harm's way. They're running out of water, as Rick said. There's no electricity. There's no food. The food is running out. WFP have said that today. They're running out of food. Medical supplies are almost depleted. The hospitals don't have fuel for the generators. As Dr. Ahmed has said, every minute we waste, we lose lives. Every second we waste, we lose lives.
Thank you, Dr. Ryan. We have many journalists asking to, waiting to ask questions. We will take as much as we can. Now, I would like to invite Donato Mancini from Financial Times to ask the next question. Donato, you have the floor.
Hi, good evening. Thank you for organizing this at such short notice and for taking my question. I had one request for a clarification. How many attacks on healthcare facilities and LPT have been recorded? Is it 150 or 115? And the other is, I would like to press you on what happened. The IDF has just put out a statement saying it has intelligence from multiple sources that indicates that Islamic Jihad is responsible for a failed rocket launch which hit the hospital in Gaza. Do you have anything to say to that? Thank you.
Thank you, Donato. I think we can start with Hyo Jong Kim, who leads our unit on attacks on healthcare initiative, to give the information about how many health attacks we have. Jong?
Thank you very much, Fadela. Good evening to all. So in Gaza, as of today, we have documented over 115 health attacks, of which 51 took place on the Gaza Strip. So, and the rest have taken place on in the West Bank side of the Palestinian situation. Of these 51 health attacks in the Gaza Strip, 15 fatalities of healthcare workers have been recorded, 27 injuries, and 23 ambulances have been affected, as well as 24 healthcare facilities. So I hope that clarifies the first part of your question. Okay.
Thank you. Thanks so much. Who wants to take the first question of Donato?
Just on the issue that Donato mentioned regarding attribution, WHO, through our attacks on healthcare surveillance, we don't attribute attacks. That's for others. That's a criminal investigation that's required to understand the source of an attack, the trajectory of any particular weapon, the origin of a weapon, and that's for others to determine. What we're here tonight condemning is an attack of this scale, of this ferocity, of this violence on ordinary people sheltering in a hospital, on doctors and nurses, on people who are already in bed, injured and wounded from previous attacks. That's what we're condemning tonight. We said the violence has to stop on all sides. And we have had this experience time and time again, where one side says they did it, the other side said they did it. Right now, what matters is there are hundreds of dead people, hundreds, if not thousands of more injured people, a hospital lost in its ability to serve its people. That's the reality. That's the brutal reality this evening. Others will determine the source. Others will sift through the forensic evidence. But the reality is that there's been relentless bombardment in Gaza over the last week, and the violence on all sides has to stop.
Thank you, Dr. Ryan. I would like now to invite Shireen Youssef from BBC Arabic to ask the next question. Shireen, you have the floor.
Hi, sorry, can you hear me?
Yes, please go
ahead.
Hi.
I actually wanted to, the previous question, I was asking if there is any information you received from the grounds team regard how it happened or who is responsible. But I think you answered the last question, so yeah, thank you. If there is any information you want to add about the responsibility or how it happened, that would be great, actually.
I think we explained well the situation. I don't know if Dr. Peppercorn would like to clarify once again for Shireen.
I think Mike, my colleague, already raised this point. We discussed this indeed in former questions. We get, of course, all kind of reports just like you get, and yes, we have teams in Gaza, but not on that spot. So we get all kind of information, and I think nobody has confirmed yet how this happened and what this happened. And I think Mike's point is very, very pertinent. We talk about attacks on health. We don't talk about attribution. As WHO, we have an obligation by the Health Assembly that we monitor, we analyze, and we report on attacks on health. Well, this is of course, an horrific attacks on health, but it's amidst, I think, it was also just said about relentless bombing over the last week, which already resulted in more than 3,000 deaths, of which half of women and children, and that, and more than 11,000 injured people. And that has to stop. That horror has to stop.
Thank you so much. We would like to take last question, and then we will give the floor to the regional director for any closing remarks. The last question will go to Isabel Sacco from EFE, the Spanish news agency. Isabel?
Good evening. Thank you very much, Fadela. I would like to know how many hospitals are still functioning in the north of Gaza, and what fears do you have that other hospitals operating there may be subject to attacks? And please, also, if you can tell us what kind of dialogue do you have with the Israeli authorities to try to avoid this kind of tragedies? Thank you.
Thank you, Isabel.
Can I start with this question? So thanks very much. So first of all, the hospitals, of course, have been overwhelmed with the rising casualties and fatalities. And at the moment, there's 35 hospitals. Four hospitals are currently not functioning because of the severe damages and targeting. And all hospitals, all of them, and specifically the largest one, Shifa, are running out of essential health supplies. And I'm not talking, we always talk about trauma supplies, but we also should talk about essential medicines for the treatment of, for example, talk about non-communicable diseases, diabetes, oncology, cardiovascular diseases, emergency obstetric care. I mean, estimated we have 350,000 Gazans with non-communicable diseases. The blood banks, they only have a week's short of supply left. Now, on the primary healthcare, 60% of the Ministry of Health primary healthcare facilities are closed, were closed today, 33 out of the 50. And they are only partially operational, and again, very limited supplies and equipment. UNRWA, which is very important in delivering primary healthcare in Gaza, they have 22 primary healthcare centers, and over the last couple of days, only 8 were functional. And they were actually partly functional, and all of them are fast running out of supplies. And so more than 64% are closed. We are incredibly concerned about the water and sanitation affecting the public health. I mean, the crisis is imminent due to the lack of water, and it is compounding this desperate situation of civilians. We are also really concerned about the risk of communicable disease and outbreaks. I mean, more than 600,000 people are displaced, more than 300,000 in UNRWA shelters and 300,000 elsewhere. Many of them in these hospital compounds. So we are really concerned about outbreaks, and we have to focus on outbreak preventions. Now, the hospital, and we also talk not only about essential supplies, the dwindling fuel supplies. Most hospitals, they have 1 or 2 days fuel left, and they're already reprioritizing. Besides the whole essential medicines, we also have to think about simple things: cleaning material, hygiene material. I mean, and to avoid infections. Already now in the hospitals, in the key hospitals, they see a lot of infections, infected patients because of that. I want to leave it here. Thank you.
Thank you.
And just, Fadela, if I can add, we have been also concerned for the health and welfare of people in Israel, for both the physical and psychological effects of the horrific attacks in southern Israel last week, and the ongoing attacks that are also causing huge problems. Our country representative there, Dr. Michel Taran, has been in the field visiting the hospitals in southern Israel. I think he's been in Ashkelon, he's been in Sderot. We have offered assistance to the government of Israel, and clearly Israel has a highly developed, highly sophisticated, and very effective healthcare system. It probably doesn't need assistance from us, but we have offered it in solidarity in any case. Historically, the medical services and physicians and healthcare practitioners in Israel have cooperated with health officials in the occupied Palestinian territories. Medicine and healthcare transcend political borders. They transcend the barriers and conflict, and it has always been so. We all take a Hippocratic oath. We all, as health workers, strive to help those who are injured, regardless of who they are. It's a very important concept, and that's why the terrible dilemma facing health workers in those facilities in Gaza, particularly in northern Gaza, as a doctor, as a nurse, their choices are horrific. They cannot move the patients. Many of these patients are highly vulnerable, on ventilators, in incubators, post-operations, having had massive operations, amputations, comminuted and compound fractures, head injuries. These patients cannot be moved safely. It would be hardly possible to move even a few patients in a highly developed and highly safe and peaceful environment. Moving hundreds, thousands of patients in the context of this conflict, in the context of what's happening, the condition of the roads, is a death sentence to those patients as well. And the doctors and nurses are choosing to stay. They're choosing to stay with their patients. And I'm sure that is exactly the same in Israel, because health workers are not a target. Health workers are there to help anybody who's injured, anybody who needs assistance. It is absolutely clear to all sides of this conflict where the health facilities are. It is absolutely clear. Healthcare is not a target. It should never be a target of anyone in conflict. That is enshrined in international humanitarian law. And we're seeing this breached again and again and again over the last week. And it has to stop. It must stop. We cannot leave doctors and nurses to make the choices they're having to make. It is inhuman.
Thank you, Dr. Ryan. Before we close this press conference, I would like to thank journalists who joined us on a very short notice. And I would like now to give the floor to Dr. Ahmed Al-Mandari for any closing remarks. And for journalists, please, you know how to reach us. Send us emails to mediainquiries@wg.int, and we will try to answer your questions. Dr. Al-Mandari, you have the floor.
Thank you very much, Padilla. Thank you, Padilla, for coordinating this important press conference, and thank you, colleagues who have joined us from different media channels. We really appreciate it. Just key messages, in fact, I'd like us to share. As you know, all colleagues, WHO is a UN agency that is responsible for the global health, global public health. It is really working very hard, with donors, partners, health authorities everywhere around the globe to make sure that we serve the vulnerable, we save lives, and we protect the health of the people. We try our level best, with everyone to make the world safe and secure place. My request, and my message to you colleagues, journalists and media as a whole, you are our partners. We cannot reach that. We cannot fulfill that expectation from our societies, our communities without your support. You are our tool, to reach those people everywhere, with the right fact, with the right information. And I have no doubt that you are doing your level best. You are exposing, endangering your life and exposing the safety of your life to get the right data. So please, please, please help us to share the right information disseminated through your right strategies, so that you will facilitate our task. And I assure you that WHO at its 3 levels, and I don't know how many thousands of staff spread around the globe serving the humanity are with you, putting their hand in your hands to continue your noble mission. So that is my message to you, colleagues. My second message is, as Mike have mentioned, in fact, and colleagues have mentioned in answering your questions, healthcare and healthcare professionals working in these healthcare facilities, patients, their relatives, are not a target and should not be a target. And whomever is doing that, as Mike have mentioned, this is a very clear violation of whatever humanitarian values, principles, laws. And we just believe everyone who is having an authority or having a role to play to really please help us in stopping these attacks, and also advocating for the safety and protection of those people who are in these healthcare facilities, or those who are mobile in the field through the ambulances, through the mobile clinic, through field hospitals. So this is my second key message. Again, thank you very much, Fadila, for coordinating this important discussion. And we really appreciate everyone who has joined us. Thank you.
Thank you, Dr. Al-Mandari, and to my other colleagues and to journalists. See you next time. Bye.